Ladies and gentlemen, abeg una watch this video to the end. There is a little competition between man and a woman. Now, two of them, they are medically related. So the woman is saying he's more intelligent than the man. So please just watch this video, comment the person that you think is more intelligent. So now, we want to invite her to give a presentation on pre-eclampsia, and while the man will be talking on Hirschsprung disease. So, and there is timing. So the time is at least 4 minutes. So let's see. Let's go. Ude.
Hello everyone, welcome to this debate. So I'll be talking about preeclampsia. What is preeclampsia? Preeclampsia is an idiopathic condition after 20 weeks of pregnancy characterized by proteinuria and hypertension in a pregnant woman who was never diagnosed of hypertension. Now, what are the causes of preeclampsia? Preeclampsia, like I said, idiopathic. What is idiopathic? Meaning there is no cause. So, but there are predisposing factors to it. What are these predisposing factors? A woman who is having multiple pregnancy, meaning plenty fetus in utero, could be twins, it could be triplets and all of that. She's predisposed to preeclampsia. A primigravida, someone that has not given birth before, or a woman that is having diabetes mellitus, or somebody that is having a medical condition, maybe like a renal failure that's relating to the kidney. There is so many things that can cause preeclampsia. Okay, so that's by the way, how do I know that I have preeclampsia as a pregnant woman? Okay, antenatally, you have to go to the hospital and get registered for antenatal. When you register, then they will have to keep checking your blood pressure to make sure that you are not at risk of preeclampsia. How is that? Now, if the systolic is above 140, then there's a problem. And then the diastolic is more than 90, then we should start looking into it. Go further to do a urine test. Is there protein in that urine? Is there creatinine? Then go further. Let's take a blood sample. Let's do a full blood count. That is another one. And then there are other signs. A woman will come. How do I know that I'm having preeclampsia? Madam, are you having headache? Check yourself. Is your feet swollen? That's called edema. Check yourself. Are you having pain on the chest, especially this area? That's called the syphilis. While you check yourself. Then they will complain of lower abdominal pain. Yeah, check yourself. There are so many reasons, and there are so many treatments. There's a treatment to it. Yes,
I want to talk about Hirschsprung disease. Now, what about Hirschsprung disease is a disease condition that affects the large intestine, that is the colon, thereby leading to inability to pass through. In children with, usually affect children with Hirschsprung disease, they find it very difficult to pass through. That is to establish the establishment of bowel. Establishment is very absent after delivery for 28 hours, for 48 hours. Now, when we talk about, let's talk about the causes of Hirschsprung disease. Now, the cause is unknown, and it also can be heredity in nature. That means if an assembly has a kind of Hirschsprung disease, the extent is that when the subsequent child may also develop Hirschsprung disease, and also it may also occur as a result of congenital abnormalities. You see, that is, it can result as a what we call genital mutations. And another thing is that there is absence of nerve cells in the muscles of the baby colon, and because those nerve cells, they are the one that actually cause the contractions, thereby allow the able to move the content in the colon. So but in this condition, there is absence of these nerve cells, so the baby will find difficult to pass through. So these are the thing, the signs. Now the causes. Now let's talk about the signs and symptoms with a baby with Hirschsprung disease. One of the signs that you discover that there will be swollen abdomen. There will be swollen abdomen. Not only that, there will be constipation or gas. Another thing, signs and symptoms is that they will find it difficult to establish bowel movement after 48 hours of delivery. Another thing is that there may also be diarrhea. The another signs and symptoms also associated with Hirschsprung disease is that most time they may be vomiting that can be a kind of greenish in nature. So these are the different signs and symptoms of a child with Hirschsprung disease. Now, what are the complications associated with it? The one complication usually common with Hirschsprung disease is enterocolitis. Enterocolitis has to do what we call intestinal infestation. That is, the intestines are being infected, and if it's not properly managed or managed on time, this may lead to the child death. So that's one of the what we call complications of the Hirschsprung disease. Now, let's quickly talk about how do we manage Hirschsprung disease. One thing way to manage this disease is through surgery, surgical intervention. There's what we call bypass. So bypass, you do bypass. The bypass is what you do by trying to do what we call pull through, where you cut the part that is uh, there's lack of these nerve cells. And we can also do what we call stoma. So these are different surgical intervention that you can do to manage Hirschsprung disease. Thank you. Abeg, you wan tell me say you no like the video? Oya, click follow. Make you dey follow me, make you dey follow me. As you dey click follow, your life go dey go forward. Abeg na comment. Why you go just see the video go just pass? Comment, share the video. As you dey share am, your life go dey go forward. And as you dey like am, Papa God go dey like you. Share the video if you like am. Abeg. I dey share. Comot the camera. Comot the camera.